Good morning, everybody. I'm delighted to represent the Social Welfare Department of the Government of Meghalaya today. So good morning to all senior officials from Government of India, from the state government, and thank you, Jaram sir, for giving me this platform today. As Ram Kumar sir mentioned in the previous presentation, that while reducing the maternal mortality rate is a crucial step in the direction of mother and child health, it is just the first step. And the natural next step is how do we ensure that the child which comes out of that mother's womb gets the right opportunities, that they can have a good quality life, right? So I'd like to begin with a simple idea, which is the foundation of this mission. And that idea is that the first 1,000 days of a child's life, right from the time they're conceived in their mother's womb to the time that they turn 2, those are approximately 1,000 days. Those 1,000 days determine much of how their child will grow to be it in terms of education, be it in terms of their health indicators, and hence their productivity, right? So we feel that, and it's not just a feeling, actually studies have shown that if the government gets these 1,000 days right, that is, if we can promote a community, let's say societal revolution of sorts, where these 1,000 days are prioritized, we don't really just reduce malnutrition, or let's say we don't really just improve our MMR numbers, but we go ahead and ensure that our child is better at education, gets a better job, and hence the economic productivity of the state goes up in general, right? A healthy child is less likely to, fall sick, so your out-of-pocket expenditure reduces, so on and so forth. So Meghalaya has already shown that change is possible. Between the NFHS 5 and NFHS 6, we recorded the fastest reduction in stunting in India. Despite that, our stunting burden is still the highest in the country. So Mission 1,000 Days is therefore an attempt to improve stunting and largely then unleash the full potential of every child of our state. And we try to do this through a whole of government convergent service delivery approach. Next. Oh, great. So I would just like to draw attention to 3 numbers over here. I mean, the numbers are on your screen, so I'll just go through what they signify. First is that despite remarkable progress, more than 1/3 of our children remain stunted. So while we're happy that we have shown a lot of growth, we know that there is a long way to go over here. Second is that less than half of our infants are exclusively breastfed. So exclusive breastfeeding would imply that in the first 6 months of a child's life, they are fed nothing except the mother's milk, and that's it. And the third statistic is that only 1 in 5 children receive an adequate diet after 6 months. So once a child turns 6 months, as you know, you can diversify their diet and introduce, let's say, some vegetables and some cereals, so on and so forth. So only 1 in every 5 children in Meghalaya gets that adequate diet. And these are not merely health indicators then, but these are indicators of our future human capital. So once we saw these numbers, we asked ourselves, why are these children becoming stunted? Why are our numbers the way they are? And therefore, the Social Welfare Department, in collaboration with technical partners, undertook an early childhood development baseline study, the ECD study of 2025. And 3 insights emerged from this study. One, and the most crucial one, is that not all children or not most children are born stunted. Unfortunately, even if they are born normal, after 6 months, 10 months of their lives, they move towards the left of this graph, which means that they move to the stunted category. Their height does not grow as per their age, and then they become a part of the stunted lot. And with time, that graph, unfortunately, has a downward slope only for every child. That's the first crucial statistic over here. The second important statistic which I would like to draw attention to, we were trying to diagnose the problem. So this is the second important insight which came, which is that in 2 ways. One is called early initiation, where in the first hour of the child's birth, you have to have the mother's milk as a child. It's a golden hour of a baby's life. And we saw, unfortunately, in our state, only around 40% of her newborn babies got the mother's milk in this very critical golden hour. Major red flag, right? And in the second factor also, which is again extremely important, exclusive breastfeeding, as I mentioned, only 23% of our children were exclusively breastfed in the first 6 months of their life. You might notice that in the second sort of diagram, the graph, For the Jaintia region, it is 0 exclusive breastfeeding. Now, even I thought that this might be maybe just a clerical error or whatever, but when I confirmed with my team, it shows that in the Jaintia regions especially, there is a lot of reliance on, the powdered milk. So a lot of mothers end up giving powdered milk to their child instead of, feeding them exclusively with their breasts. So again, big problem. And the last very crucial statistic that we saw, which kind of explained the problem in our state, is that minimum dietary diversity, which means that post 6 months to 24 months, when your child is supposed to get all sorts of, let's say, vegetables and grains and dairy products, of course, in moderation, we saw that only 16%, or let's say approximately 15% of our children got the minimum dietary diversity in those 6 to 24 months of their life. Very, very unfortunate. And as you can see, another correlated statistic is that around 54% of our parents responded that in that age group of 6 to 24 months, when their child was 6 months to 24 months old, they did admit that sometimes they would feed junk food to their children. Yeah, so it's not as if, I'd just like to clarify, it's not as if that these parents know that this is wrong. Unfortunately, in very remote and rural areas of our state, this awareness is not as loud as it should be, that you do not feed your child, let's say, that cheap 5-10 rupee wafer or so on and so forth. So unknowingly, our children were not getting the adequate diet that they need, and hence this was having an impact on not just stunting, but general cognitive development, so on and so forth. So based on all of this, the state government, under the leadership of our Honorable Chief Minister, devised the Mission 1000 program, which is built on a fairly simple idea that every pregnant woman and every child up to the age of 2 should receive continuous targeted support. And rather than introducing another sort of new scheme, this mission is about integrating existing frontline systems through 5 pillars. These are the 5 pillars. This is the most important slide of this presentation. So I'll just make this fairly simple. The first pillar of this mission is build, which is about the capacity of our frontline workers. So the Social Welfare Department has partnered with IIT Bombay, and through which we are training 22,000 frontline workers, not just of Social Welfare Department, but of all related departments, be it the Health Department, be it the CNRD Department, so on and so forth. So our ASHA workers, Anganwadi workers, CGHAs, around 22,000 of them are being trained. They will then adopt 240,000 mothers and babies, and they will impart the training on exclusive breastfeeding to these beneficiaries. So exclusive breastfeeding is also a science, in the sense that while for most of us sitting in this room fairly privileged, it might seem very obvious to us, but like I said, in places where there is an awareness gap or information asymmetry, you really need to train and break the years of conditioning that this is not important. So basically the way you hold the baby, the way, the duration you feed them for, these things become very important. So the first pillar will focus on effective breastfeeding and nutrition. The second pillar, which we call empower, wherein we will also directly be engaging with mothers through these mother skill workshops, and basically scientific practices, right? The fact that small things like you should, spend quality time with your child, you should, maybe sing a song to them, nursery rhymes, so on and so forth. As you guys know, with digital technology, and also because most of these mothers are also in the primary sector economy, where perhaps because of the drudgery of their labor, they might not have that much time. So these practices are slowly dying out, and these are very important for the cognitive development of the child. So these kind of soft skills will be given to mothers, along with conditional cash incentives. And this is very important because we found that in Brazil there was a Bolsa Familia model, wherein money was given to those mothers who completed, let's say, certain targets. So in our case, it's going to be, let's say, exclusive breastfeeding. So for 6 months, the frontline workers will monitor every mother, and through the QDwell app, yeah, it's come on the bottom of the screen. There's an app that we have made. So each frontline worker will be uploading on the app, okay, for this particular fortnight, this mother exclusively breastfed her child, so on and so forth. So over 6 months, based on that assessment, we will be giving 1,000 rupees a month to each of these mothers so as to promote and incentivize good behavior through this economic incentive. The third pillar is nourish. So Through this, we want to ensure that locally available food products are popularized, in the sense that simple, easy recipes through SHG workers, through Anganwadi workers, are promoted in the community. So, for example, things like the leaf of buckwheat or fish mint, it's a very popular local herb, or plantain. So, simple, easy recipes using locally available ingredients, so that the health of the mother and the health of the baby are both taken care of. The next pillar is celebrate, where basically, at the Anganwadi center where these mothers regularly come, we will be giving, of course, hot cooked meal is a part of ICDS, but the state government is introducing eggs to the mix because, as most people would know, that eggs are a complete source of protein and easily digestible, so on and so forth. But we're also recognizing the positive behaviors of our frontline workers through, again, incentivizing them and through community recognition. And the last pillar is rescue. So we recognize that despite all of these efforts, there might be 10 to 15% of children who might falter. And because this program is based on very scientific data management, so through this QDwell app, there'll be pings, there'll be alerts to, let's say, the concerned frontline worker and even to the mother that, hey, your child is not showing the right age or the right weight as per their age. So that's when the VOs, the voluntary organizations at the community level, come in, and they are given, let's say, more protein-rich foods like egg and soya to ensure that these faltering children can come back to the baseline. Right, so this slide is now about the details, in the sense that how do we do this, right? So we are trying to ensure that we focus on each and every child, and each frontline worker follows a standard protocol at every visit for every child from the time they're born up till 24 months. So as you can see in this diagram, there are all sorts of personnel involved over here, and hence this program relies heavily on community mobilization and hence the capability building of the entire community. So there is a learning action protocol that is imparted to these community workers, where they are given the adequate devices so they can measure the weight of the child, the height or the length, in this case, the length of the child. Then that data is fed on the app. Then there are also guidance tutorials which are regularly shown to mothers to ensure that correct behavioral practices are encouraged, and there is an escalation mechanism if weight or height or any other threshold is mixed. So here, as you can see, I've already spoken about this. There is a whole of government approach. Next. Like I mentioned, this is an elaboration of the whole of government approach, where we have the State Human Development Council headed by the Honorable Chief Minister, under which we have formulated the Meghalaya Early Childhood Development Mission. As Ramkumar sir had also mentioned, this kind of an intervention cannot be one department alone. We have around 5 departments here which are working in tandem and right down to the village and the block level. And the most important thing is that through adaptive learning, we are trying to measure impact, right? So where there are good, let's say there are good trends, we want to understand, okay, how is it we can replicate to the state? Of course, where there is faltering, we would want to rapidly experiment and understand how local innovations can come in. And lastly, of course, that we can do a system level research through all our learnings and implement it across the state. That's all from my side. Thank you very much.